Hello, welcome to another edition of Health Matters. I'm Dr. Bruce Karlin, your host, and we're having another edition brought to you by WCCA TV and Worcester District Medical Society. Tonight, it's my pleasure to bring back one of my favored guests, Dr. Alwyn Rapose, our infectious disease expert who's going to talk to us about vaccines. Alwyn is a infectious disease specialist working with Reliant Medical Group and one of my favorite consults. Welcome.
Thank you. It's a pleasure to be here, and welcome to all the people viewing the program.
So tonight's topic is pretty timely because we're in flu season, or just beginning, and the most important treatment is a vaccine. So we thought we'd talk about vaccines in general and flu specifically, the flu vaccine. So why don't we just jump right in and tell me, why should I get a flu vaccine?
A very valid and relevant topic for today. The flu season is just starting out. In America, we have the flu season that starts like mid-October, goes right into the middle of the next year. And we have a lot of senior population, very young population, people with underlying lung disease. So these people, if they get sick with the flu, they can have bad outcomes. And in general, the otherwise healthy person will say, well, you just mentioned the sick people. If I get the flu, I'll be fine. But the point is, if you get the flu, you are going to be around some sick people. So you could transmit the flu to the sick people. It could be your wife who's pregnant. It could be a young child. It could be a senior in your home, or it could be a senior you're visiting. So it makes sense that almost all of us, or all of us, are encouraged to get the flu vaccine to protect ourselves and to protect the people around us.
My former partner, who was an endocrinologist, but when he was in training in his internship year, he got the flu. And he said it basically wiped out his year. So even if you're healthy, getting the flu is no fun.
Yeah, it's true. I would say that most of the times if you get the flu, you're young, healthy, you could recover on your own in about 5 to 7 days, unless you really had a bad episode. And then we do have modern medicine. We do have medications against the flu disease, and you could get well at the end of the course. So you might not be so sick. But the point is that if you get the flu, you're likely to miss work. And more importantly, or more scarily, you could infect some of the vulnerable population, somebody who's very young, somebody who's very old, in your own family and in the places where you work. So a lot of emphasis on flu vaccine. It's a very safe vaccine. The vaccine is no longer made in egg. Now many people used to say, oh, I'm allergic to eggs, I don't want to take the vaccine. So now it's an egg-free, cell-grown vaccine. And the flu vaccine has been developed over the years. It's not a new vaccine. We know the vaccine very well. There might be slight modification from season to season based on computerized models that tell us, what is going to be the most common type of flu virus that's going to be in the circulation that season. So based on what the expectation for this season, the CDC has already recommended a quadrivalent vaccine. We know it is safe.
Quadrivalent for
yeah.
four
Quadrivalent means it involves taking care of the 4 most predicted viruses that are going to cause the flu outbreak this season.
So let's backtrack just a step. When you say flu, why isn't the flu the same from one year to the next? What changes? Well, let's start with that. And then,
So flu, we say, is the disease, influenza disease. It is caused by virus, the influenza virus. And there are different, you could call them brother-sister viruses. They are brothers of each other. So in one season, there may be a flu virus that's slightly different from the other, and we give them numbers. We can have H1N1, H3N2, and H and N are chemicals that are on the surface of the virus, and that helps us to identify the virus, and the virus identifies the human cell which it attacks. So we identify the viruses with these names, H1N1, and we give them different names, avian flu or the swine flu or the bird flu, based on where they were first seen or what are the most common animals or the type of disease they produce in the community. So the viruses that are expected to cause disease this season are 4 different types of flu viruses, and they have been incorporated in the flu vaccine this season.
So if you get a vaccine one season, why doesn't that protect you for the next season, or does it to some extent?
Very good question. For 2 reasons, we like patients to be vaccinated every season. Number one, the vaccine effectiveness is definitely not for more than a year. In fact, it is less than a year. So if the flu season extends beyond, say, May or June, you have a high risk of getting the flu disease, even if you've taken the vaccine in October. So first point being that the effectiveness of the vaccine is definitely less than a year. So next year, you as if you've not taken a vaccine the previous year. And the second reason being is that there is no guarantee that the next season will have the flu disease caused by the same virus. So we have to modify the vaccine.
So the brothers, although close, are different. And they're like getting a new virus altogether.
Yeah, so the new virus may not be affected by the protection you got from the previous year's vaccine.
Okay, but you've got some little holdover on that.
I'm not sure that there is any holdover. In fact, maybe after 7 to 8 months, the antibodies that the vaccine produces really falls to very low levels, and I do not think that there is some benefit. Though some studies have shown that people who get flu vaccinated regularly have a low chance of getting the flu the next year, but there are some other studies that showed something else. So not really consistent data to support.
So the data is on both sides.
I'm not sure that.
But the data is very good that if you get your flu shot for the season, you get substantial protection from what's going around that year.
Yeah, it's also very important to know that getting a flu vaccine is not a guarantee against flu, that you will definitely not get the flu disease. The vaccine, we know, gives us about 40 to 60% protection, which again is very good. However, it's not 100%. So if you get the vaccine in October and you fall sick in January, you need to be tested for the flu and treated for the flu if it turns out that you do have the flu. Of course, flu-like symptoms could be mimicked by other viruses too. So it's important to be evaluated by your physician, important to be tested for flu even if you've got the flu vaccine. Now, sometimes I see patients, they come to me and they said, oh, I got the flu vaccine and I got the flu. That's very important that that's not true. It's very important to understand that. This vaccine does not have live virus. So you cannot get flu from the vaccine.
But you can get some symptoms sometimes. Yeah. People get aches where you give them the shot.
Absolutely.
And you get there is an immune response, so you can feel that.
Yeah. Just like after a tetanus shot, you can feel pain in your arm, or you get 2 or 3 vaccines. And the children scream after they get vaccines, and they could run a temperature after they get their childhood vaccines. We still give them their vaccines. In the same way, very rarely, you could get flu-like symptoms from the flu vaccine, but that's your immune system mounting a response. And as a physician, I would say, hey, that's a good thing. That's a good thing that your body had a good response. But we would like to clarify that you do not get flu disease from a flu vaccine.
Well, they've actually done the study too.
No, it's not a virus. You cannot get
it. No, but they've done the study to show that the symptoms happen as frequently with sham shots as they do with real shots.
I haven't seen that study, but you may be right. But again, my explanation to the audience is, to our viewers, is you cannot get the disease from a vaccine that does not have a virus or a disease in the vaccine. The function of a vaccine is to pretend to be a disease, and your body mounts an immune response that protects you 40 to 60% from the real thing. And that's the role of the vaccine.
So how do we know what the real thing is? How does the CDC say, oh, these are the 4 most likely? What do they do?
You get high fevers, you get body aches.
No, I'm talking about how do they know which vaccine to make?
Oh, so the way they get the vaccine is based on computerized models. So they evaluate what has happened in the season before, they do environmental studies, and they calculate to see, hey, this is the most likely virus going to cause this outbreak. And remember, they are not just taking a chance with one. So they say, okay, this is the most likely, this is the second most likely, this is the third most likely, and this is the fourth most likely. So they combine all these likely viruses, and they put it a matching vaccine to protect you against these 4 viruses.
I also thought that they knew where the travel routes were and checked.
Remember, the vaccine is made before we have the outbreak.
But
so
the outbreak is someplace else, isn't it?
No. The vaccine is a computerized model. It's not based on data from what we have. Again, you could say it's based on data from what we have, but it's a guess of what's going to happen in the future. And it's a pretty good guess.
They've been pretty good about it.
It's a pretty good guess based on the results that we get of 40 to 60% protection. There have been times when, nature is bigger than any of us. So, they can have a flood, they can have a migration of birds, or they can have a change in predictions, and we could go wrong. So there have been times when the vaccine was like 20% effective and people got the flu. But last year it was around 40 to 60%, and we expect the same this year. It's important to realize that this vaccine, like any other vaccine, is not 100% guarantee. But that should not stop us from getting the vaccine, because the disease itself is a pretty nasty disease, especially if you have an underlying medical problem. It's a nasty disease. Even for healthy persons, they miss their work, and as I mentioned at the start, they could cause transmission to other people who are sick. So it's a safe vaccine, it's pretty effective, and I would strongly encourage our population to get the vaccine.
Listen, I got mine.
That's great.
And I get it every year. I'm first in line.
Yeah, we as physicians have an added responsibility, because if I get the flu, I think I'm young, healthy, and I'll pretty do well with without any medications. Or if I really want, I can take some medications. But you see, every disease has an incubation period. So the time before I got sick, I could transmit it to my patients.
Yeah.
So that's an important point that, why we as physicians or healthcare workers or teachers in college have a little added responsibility, not only to themselves and their families, but also to the people we work with. And again, I would strongly recommend that it's a safe vaccine. You do not get flu from the vaccine, so please take the vaccine.
Let's move on to other vaccines. Tell me about measles, mumps, rubella. There have been recent outbreaks, and yet that vaccine is virtually 100% effective.
It's a very, very effective vaccine. Very nice topic that you've chosen to talk about. We thought we had eliminated measles from the U.S. in the early 2000s, 2002, around 2005. We thought we had eliminated endemic measles, which means that we did not have a new case of measles in America. However, we've had outbreaks of measles in America. What happens is either immigrants bring it in, or people from America have traveled abroad. They were not vaccinated or did not have immunity. They picked up measles from abroad, they brought it in, and then they spread it among people who were not vaccinated. So who is not vaccinated? Children less than 1 year of age. Here in America, the MMR vaccine, measles, mumps, rubella vaccine, is given at the age of 1 year and is given at the age of 4 years.
Why did they pick 1 year as the point? Why don't you give it, say, just from the delivery room?
Yeah, that's a good question. Interestingly, there are many reasons. We cannot go into all the details, but the newborn child has protection from the mother, and if you give a vaccine too early, it will wane off. So there is a calculation that they make, and the best times. I know that they used to give it at 9 months of age, and then now they give it at 1 year of age. But remember that we can give it earlier if a person is going to be at risk. So even today, if a young child who's 10 months old is traveling to another country, we would like them to get vaccinated before they leave the country, before they leave America. And the vaccine is considered safe after 6 months of age. But here, as a routine, there are many advantages of having a standard vaccine protocol. If everybody does whatever they want, there will be a lot of confusion, less doses. So here it's very standard, also based on scientific evidence as to when you develop adequate antibodies for protection. So the children get it at the age of 1 year and at the age of 4 years. But I've seen it often. We run a travel clinic, and then people who could not document their 2 vaccines, we get blood tests. And very interestingly, people who could have sworn that they had their vaccine, or they knew that they had measles when they were a child. My mother told me I had measles. We do a test, and they come back without evidence of
without
measles,
antibodies.
without evidence of measles protection. The other group of people who do not get the vaccine are people who do not believe in the vaccine or feel that they can cause harm. As you can understand, everything we can do in life can have a potential side effect.
It has a risk.
Any food you eat, you could be allergic to it. People have food allergies. You drive on the highways, you could have an accident. So vaccines can cause trouble. But this measles MMR vaccine has been around for many years, and thousands and millions of people have been vaccinated. So it is considered one of our extremely safe vaccines. And there could be a person or two here and there who have had a side effect. But overall, the society has eliminated a lot of measles, mumps, rubella because of this vaccine. And rubella in pregnancy, measles in pregnancy can have a lot of bad outcomes. Similarly, small children, if they get measles, they can have neurologic side effects.
I don't think people appreciate how sick you can get from the diseases we're protecting you from. I've still got a couple of patients who have poor eyesight and poar hearing, secondary to neonatal measles that they had. And if you haven't seen it, you say, well, it's not. What's to worry about? But these can be devastating diseases.
Yeah, it's the same thing like polio. We have not seen much polio today, so we do not realize what a devastating disease it is. We do have still some parts of the world where polio has not been eliminated, but we have eliminated polio from America. And that's because we did the vaccine. So we hope, we encourage, and we as infectious disease physicians would encourage our families strongly to vaccinate children with the measles, mumps, and rubella vaccine. Again, the dose is at 1 year and at 4 years. And if you're traveling out of the country, you are allowed to have it. In fact, strongly encouraged to have the vaccine before you leave the country.
So, in general, all the vaccines have wonderful safety profiles, and there is no evidence that there's any autism from any of these vaccines, which is a theory that's out there that's been thoroughly disproven. What other vaccines do we recommend on a regular basis now?
One of the vaccines that we would recommend is a pneumonia vaccine. And this is recommended for people who have underlying heart disease, underlying lung disease, underlying liver disease, and underlying kidney disease. Another vaccine that has been recommended above the age of 50 is the shingles vaccine. So these are some of the vaccines that are now available. They have been studied. Again, these vaccines do not cause a disease. So you get a pneumonia vaccine, you do not get
There's
pneumonia.
No live virus available.
One of the older shingles vaccine, the older shingles vaccine actually had, it was called a live attenuated vaccine. But the newer vaccine, which is called the Shingrix, it's an inactivated vaccine. So again, you cannot get the disease from the vaccine.
Just take a step back on the pneumonia vaccine. People hear the word, oh, I've had the pneumonia vaccine, I can't get pneumonia. But in fact, we're only, again, doing one of the brothers. We don't get the whole family. So
we have a couple of vaccines that we recommend in adults, and then again in children there's a different vaccine, and that's a whole ball game. But in adults there are 2 pneumonia vaccines, and they are numbered. There's one called PCV13 and then another one called PPV23. So what is 23 and what is 13? These are the types of brothers and sisters that they have of the Streptococcus pneumoniae bacteria.
So that's only one kind of bacteria.
The Streptococcus bacteria.
You can get different pneumonias with different bacteria, and it's still called pneumonia, but it's not at all covered by these vaccines.
Yeah. It's important to realize that the amount of pneumonias that were going around causing infant mortality, child mortality, were markedly reduced after introduction of these vaccines for children. And with the same thought process, we have introduced these vaccines for adults. Now, while it is understandable that there is no single vaccine to cover all the diseases, having a vaccine like the pneumonia vaccine that markedly reduces your risk of Streptococcus pneumoniae, which is one of the most common bacteria causing pneumonia, is very important.
But it's not just Streptococcus. You got the ugliest brothers of the crew covered by your vaccine. So there could be hundreds of different brothers, and we just chose
That's true.
the 13 most deadly.
Yeah, they took the 13 most commonly causing disease. See, there's also this battle, correct? We human beings want to kill the bacteria. The bacteria change their formats to try to bypass what we are doing. So, we try to protect from the 13
bad brothers.
Bad brothers. Medical term for that is called serotypes. We protect from those 13 and we protect from those 23. And then we might get infected with a serotype 24 or with a staph infection. But don't forget that we have protected against the most common cause of the pneumonia. So it's important to take the vaccine. So who should take these pneumonia vaccines? Somebody who will get very sick from a pneumonia. So all of us can get very sick from a pneumonia. But if you already have underlying lung disease, you already have underlying heart disease, if you already have underlying kidney disease or liver disease or cancer, these are the patients that have poor outcomes from a pneumonia. So in spite of antibiotics, they might be very sick. So prevention, and how do they say it? An ounce of prevention is better than a pound of cure. So antibiotics are great, but if we can prevent an infection with a vaccine that's very safe, as an infectious disease specialist, I would strongly encourage you to please take these vaccines.
And moving on, I sort of backtracked. You're going to talk about shingles vaccine.
Shingles vaccine. It's a good vaccine. Shingles is a disease caused by reactivation of the chickenpox virus. So if we've had chickenpox in childhood, we recovered completely from the chickenpox, it may remain hidden. And then it comes out at times of stress or at times of weakness in the form of a rash, which is very painful. And most people would recognize that. It comes along a line on the skin.
That's why it's called shingles. It
called
looks like a row of shingles.
Like a row of shingles. So it comes, and it can be very painful, and it's associated with very nasty pain, not only at the time of the rash, but you can have pain after the rash goes away, and that can be pretty it can last a long time. It's called post-herpetic neuralgia. So in an attempt to decrease the risk of shingles, the shingles vaccine was developed. It's important to know that this is, again, not 100% preventive. So the vaccine, you give any vaccine, the effectiveness wanes over the years. So the initial vaccine, they said like maybe after 10 years you had like almost 0% immunity or protection at the end of 10 years of the older vaccine. So they developed a newer vaccine which is of 2 doses, and it's available for anybody above the age of 50 years. So you give them 2 doses 2 months apart, and it's been approved only in 2017. So we are still waiting to see what it looks like after 10 years. But it's considered at least 90% protective over the years that it has been studied.
So there are so many vaccines to talk about. We have a little bit more time to talk about them. Do you think we have maybe touch on hepatitis A, which is now, it used to be, what did we call it, infectious hepatitis early on, and what's happening with hepatitis A these days?
We'll talk a little bit about hepatitis A, and also I would like to touch on a little bit about the tetanus vaccine. We'll go first quickly to the tetanus vaccine. We use the word tetanus vaccine, but we have a combination of tetanus, diphtheria, and whooping cough. It's called the Tdap vaccine. So we got Tdap once, sometime many years back. And then the P, that is the pertussis, or the whooping cough disease, our protection from that has gradually waned. So we are seeing outbreaks of whooping cough, and we had something in Massachusetts. We've had it in some schools. So I would like to remind folks that if you do not know if you've had the Tdap, ask your primary care physician to make sure you've had the Tdap at least once in your adult lifetime, and then every 10 years you can get a TD, that is tetanus diphtheria. So that's important. Coming to the hepatitis A vaccine, we used to consider the hepatitis A vaccine to be a travel vaccine because we didn't see hepatitis A in the US for many, many years. However, we are now seeing outbreaks of hepatitis A. In San Diego, there was a big outbreak in the homeless population. In Massachusetts, we are having an ongoing outbreak right now. So the vaccine is given in 2 doses on day 1, and you can repeat it. You should repeat it after 6 months, and that gives it's a very effective vaccine. We consider 1 dose almost 90% to 95% protective, and then when you take a second dose, that's almost like 100% protective. So we are encouraging patients in shelters and patients with underlying liver disease should be getting hepatitis A vaccine. And again, this is, as I've said before, we have overcome a lot of diseases, but some infections try to fight us back, and they come back if we let our guard down. So these are safe vaccines, and we would encourage people. Here in America, all children above the age of 1 year are getting the hepatitis A vaccine, but you and me, we didn't get the Hep A vaccine because the new recommendation. It was not recommended.
It wasn't there.
So if we are working with homeless population, and we're working, and I think it would be advisable to get, if you had any chance that you have a risk for hepatitis A, you should get the vaccine. That's the current recommendation.
We have just about another minute. Can you just briefly talk about how good the surveillance is by our government in terms of keeping us abreast of what's all these things that you're giving off as well? We know we had an outbreak here, we had an outbreak there. I mean, that's the CDC working for us. That's really impressive what they do.
I think it's a big job. The Department of Public Health has to put off so many fires. But at the same time, even when there are no fires, they collect a lot of information that helps us make sensible or reliable decisions when there is a fire. So they do a very good job of collecting the information, transmitting the information.
And that's our signal. Another thanks to Dr. Alwyn Rapose for being our guest tonight. This is Dr. Bruce Karlin for WCCA TV and Worcester District Medical Society. Thanking you for watching Health Matters. Thanks again.
Thank you.